Can your microbiome guide future UTI antibiotics? Imagine your body as a bustling city, full of tiny residents working together to keep everything running smoothly. These residents are your microbiome, a community of bacteria and other microorganisms living in and on your body. Recent research suggests that understanding this community might help us better manage urinary tract infections, or UTIs, in the future. UTIs are common, especially for people with bladder health issues or those who have had bladder cancer. Traditionally, antibiotics are used to treat these infections. They work well most of the time, but they can also disrupt the balance of bacteria in your urinary and gut microbiomes. When this balance is upset, it can sometimes make future infections more likely or harder to treat. Scientists now know that the bladder is not sterile as once thought. It hosts its own microbiome, which may help protect against infections. If this protective community is disturbed, harmful bacteria can take over, leading to UTIs. Repeated use of antibiotics can kill beneficial bacteria along with harmful ones, creating a cycle where infections become more stubborn. Current medical guidelines recommend using antibiotics carefully. For simple UTIs, short courses of targeted antibiotics are usually enough. For more complicated cases, like those involving bladder abnormalities or after bladder cancer treatments, doctors often perform urine cultures to identify the specific bacteria causing the infection. This helps them choose the most effective antibiotic and avoid unnecessary use, which can lead to resistance. Looking ahead, researchers are exploring whether analyzing a person's microbiome could help predict who is at higher risk for UTIs. For example, if certain beneficial bacteria are missing from the urinary or gut microbiome, it might signal a higher chance of infection. This information could help doctors decide whether antibiotics are needed or if alternative strategies might be better. Some early studies are investigating microbiome-based therapies, such as probiotics or even fecal microbiota transplantation, to restore healthy bacterial communities and prevent recurring UTIs. While these approaches are promising, they are still in the experimental stage and are not yet approved for routine use. More research is needed to confirm their safety and effectiveness. For individuals living with bladder health challenges or after bladder cancer treatments, maintaining a healthy microbiome might be especially important. These treatments can alter the urinary tract and increase infection risk. Supporting your microbiome could be a helpful part of overall bladder health, but it's important to remember that this is still an emerging area of science. Right now, the best approach remains following your healthcare provider's advice. Antibiotics prescribed based on urine culture results and current guidelines are the most reliable way to treat UTIs effectively. The hope is that someday, microbiome analysis will help personalize treatment, reduce unnecessary antibiotic use, and lower resistance risks. But until then, always consult your doctor for the best plan tailored to your needs. In summary, your microbiome holds exciting potential to influence how we treat and prevent UTIs in the future. While this science is still developing, current medical practice emphasizes careful antibiotic use guided by clinical evidence. As research progresses, we may see more personalized approaches that consider your unique microbial community, helping you stay healthier and reducing the burden of recurrent infections. Always talk to your healthcare professional about your individual health and the best strategies for managing urinary tract infections.